Hello, everyone. Good evening to all of you. I'm Sayukta from Bladder Wellness Team, and I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, stone management. Stones are hard deposits made of minerals, salts that form inside the body. Diet, excess body weight, some medical conditions, certain supplements, and medications are among the many causes of stone formation. There are many types of stones like calcium, uric acid, etc., etc. Stones can occur within the kidney itself as well as in the ureter, that is the tube draining urine from the kidney, or in the bladder as well. To throw more light on the subject and guide us on what's right for diagnosis and treatment of urinary system stones, today we have with us renowned urologist Dr. Ajay Agarwal, who is an MBBS, MS, MCH urology, consultant urologist, and medical director from Delhi, is here with us. A very warm welcome to you, Dr. Ajay Agarwal.
Thank you. Thank you.
So, doctor, as today we are going to talk about urinary stones or urinary system stones. First of all, what is stone? Stone होते क्या है? कितने तरह के stones होते हैं?
Uh, as you already introduced, there are several types of stone, right from kidney. Then from kidney to bladder, there is a one small tube which connects the what actually is kidney. Our urine is formed in the kidney. Then it gets transported to the bladder through a small tube that is ureter. Then urine gets stored in the bladder and it remains there urine for 3 4 hours. After that we pass urine through the normal passage that is urethra. So
Right.
some because we eat a lot of vegetables, proteins, carbohydrates, and these body excretes salts liquid in the form of water urine and forms the urine. So sometimes what happens, these salts get precipitated because of supersaturation. The thing is supersaturation. Like if the water is less, like urine volume is less, these salts like calcium, oxalate, they get precipitated, uric acid, and form stones. Usually they form in the kidney in the form of small nidus, means the small crystals, they appear in the kidney, they remain stuck there. If you keep drinking a lot of fluids, they may dislodge and pass through the urine, and you never know also. But if they these because it's a process of crystallization, so if the nidus becomes bigger and bigger and bigger, they form bigger stones. And if they become bigger than 6 to 7 mm, what happens, if they are less than 6 stones, they
Mhm.
usually pass through the ureter and they cause little bit problem. And these small stones pass out from the body with the help of medications. But if these stones become bigger in size, then we need surgery, any
Right.
form of intervention to get rid of stones.
We'll talk about that as well, kind of surgeries, kind of interventions to take the, stones which are bigger in size. But before that, doctor, what are the symptoms that a patient gets when he or she suffers from urinary system or urinary system stones?
If the stone is there in the kidney, usually sometimes patients come with very large stones. These are called staghorn, like 4 centimeter, 5 centimeter. Even then, they don't cause no pain. But small stones, if they come and block our urinary system, like if they come or uh, they block the ureter, the flow of the urine from kidney to the bladder. That tube, as I told, is ureter. So if they block the
Mhm.
ureter, you will have severe pain, which starts from your back, goes to the front of the abdomen. You may have vomiting, and this pain is called very, very severe colicky pain. It is called. You have to
Mhm.
once experience that how severe it can be. So the ureteric, it is called ureteric colic. Like if the stone gets stuck in the ureter, it is very severe and it is called ureteric colic. And then sometimes stones are there. These are not very common, but rarely they may form in the bladder. So they may cause you like flow is not good. You are feeling obstruction, and you may feel sometimes blood in the urine. Sometimes these stones may cause infection in the urine, may lead to fever, and uh, sometimes you may have urinary retention also, means you are unable to pass urine. They may stuck in your urinary system. So these are the most common symptoms: pain, fever, bleeding in the urine, or rarely retention of the urine.
Right. So these are the cause. In case you have these cause symptoms, please go consult a urologist as soon as possible. Don't ignore your symptoms. That's really important to get proper advice at the proper time. और जैसा कि डॉक्टर ने कहा कि किडनी स्टोन का जो पेन है वो बहुत ज्यादा होता है। जिन लोगों ने ये पेन एक्सपीरियंस किया है वो कहते हैं कि इससे ज्यादा दर्द शायद और कभी नहीं होता जितना इसमें होता है। तो कई बार उसी से समझ में आ जाता है। लेकिन फिर भी कई बार सिम्टम्स बहुत छोटे छोटे होते हैं। उन्हें इग्नोर मत कीजिए, डॉक्टर से संपर्क कीजिए, ये बहुत जरूरी है। उस वक्त होम रेमेडी करना, नुस्खे अपनाना, ओवर द काउंटर मेडिकेशन ले लेना, ये काम नहीं करता है। बहुत जरूरी हो जाता है कि हम डॉक्टर से संपर्क करें, सही डॉक्टर से संपर्क करें। डॉक्टर, व्हाट कॉजेज दीज स्टोन्स, हाउ आर दे फॉर्म्ड इनसाइड आवर बॉडी?
As I told, like when we body excretes our substances, so it is water. Then there are several minerals which are excreted through urine in the form of salt. So when the most important is when the amount of urine, the liquid, the water, if it is less, and amount of salt is more, so these salt precipitate. There is a limit. Like if we keep on adding sugar or salt to the urine, a limit comes when it doesn't get precipitate. It doesn't remain dissolved in the urine, in the water. So that is true with urine also. If the amount of salt is more and volume of urine, means urine water, is less, so these salts get precipitated and they form stones. So the main, I would say, the person who is forming stones again and again, we always tell them, you keep drinking a lot of fluid. Keep drinking a lot of fluids is actually, it varies from season to season. Like if we talk about winters, your body requirement of water is less. Why? Because we are losing less water through your sweating, because you are not sweating, even through which it is called insensible loss of water. Like when we are breathing, we are losing a lot of vapors to keep our body cool in summers. We are losing a lot of water through breathing, through perspiration, that is sweating. So these are two insensible losses which we don't recognize. So what happens in summers? We are losing a lot of water. So the formation of urine is less. Like if we are drinking 3 liters of water and we are sweating a lot, we are in the hot, humid atmosphere. So the amount of urine which is formed is very less. So when the urine amount is less, these salt gets precipitated and form stones. In winters, if we drink 3 liters of water, we are passing almost, as everybody realizes, we pass more urine in winters, but summers we are passing very less urine. So that is the main, I would say, the cause of formation of stones. So we should keep ourselves well hydrated, pass a lot of urine in summers. So that is the best way to avoid formation of stones.
Very well said. So keep yourself hydrated. That is really important. Otherwise, as well, and in case you have the history of, urinary tract or urinary system stones or kidney stones, etc., then you need to be even more cautious, and please check on what amount of fluid you are intaking. That's really important. And doctor, initially you were telling us that how, when the size of kidney stones or stones are not that big, it, normally passes away through the urethra. Then you need surgeries for stones that are bigger, or intervention, medical intervention, etc. So what all treatment options are there for these stones?
Before going to treatment modalities, what treatments are available, I would like to emphasize one thing. Like what happens, people are ignoring, like if they have very big stones also. So there are several in our India. You can understand the quacks or homeopaths. I don't criticize, but for bigger stones also, they keep on giving medicines. Actually, what happens, 5 to 7, maximum 8 stone can be passed out through the urine if we take medicines. But for like 10 20 stones, there is no way it can be cured by medicines alone. Sometimes we see very frequently that patients coming with uh, the kidney function is lost, the kidney gets non-functioning because of stones. So we feel very bad because in today's era, the removal of stones is so you can say easy, without pain, if you are getting it done by a specialist. So it is painless, almost painless, as compared to like what we were doing 20-25 years back. It was almost open surgery. We were giving this much big incision in the flanks. Nowadays, for a, or I say like for a small 10 stone, we used to cut 12 centimeter. Now, for 12 centimeter stone, we cut only 1 centimeter now. So there is a drastic change in the treatment modalities. So we should take medicines. It is not that we should not take medicines for stones, but we keep monitoring that whether they are going or not going, what damage they are doing to the kidney. We should be very, very careful. If we just forget, because what happens, these medicines, they don't, sometimes I think some a strong analgesic pain reliever is there. So these patients don't feel pain and they forget. And they, if they get, and the, I would say the investigations like tests are so simple. The one of the commonest tests which is prescribed and it is so painless, that is ultrasound. So easily you can get ultrasound, and most of the kidney stones can be diagnosed by ultrasound. When, as and when required, we go for CT scan. But majority of the information we get by an ultrasound, which is harmless, which can be done at a very normal cost. So we should not ignore. Now coming to what you asked, like the treatment modalities, there are several. Like if the stones are in the bladder, in the ureter, in the kidney, majority of the stones now can be removed endoscopically. That is, putting a telescope inside our body through the normal urethra, through the normal urinary passage, and without giving any incision in the body, that goes right from urethra into the bladder, into the ureter, and right up to the kidney. So majority of the stones can be done by endoscopically without giving any cut. But no, but if the stones are very bigger, like 20 30 60 in the kidney, that can be removed by giving a, usually by giving a small 1 centimeter incision in the back and going inside the kidney, seeing by the telescope and breaking by the different methods. That is, laser helps in the breaking the stone, making it into smaller pieces, and can be clearly removed from that small tract, that is hardly 1 centimeter. So majority of the stones nowadays can be managed without giving big cuts, and majority without even giving a centimeter cut also.
बहुत अच्छे से आपने समझाया कि सबसे पहले तो क्यों जरूरी है कि आप एक क्वालिफाइड यूरोलॉजिस्ट के पास जाएं अगर स्टोन है, और पूरा ट्रीटमेंट उसका कंप्लीट करें। आपने बिल्कुल सही कहा डॉक्टर कि बहुत सारी बातें हैं, कई नुस्खे हैं, कई ऐसी अलग पैरेलल मेडिकेशन थेरेपीज चलती है, उसमें ऐसा दावा किया जाता है कि दवाई से किडनी स्टोन्स रिमूव हो जाते हैं बॉडी से। कई लोग कहते हैं कि अल्कोहल लेने से, बियर लेने से किडनी स्टोन अपने आप ब्रेक हो जाता है और वो पास ऑन हो जाता है लिवर के यूरिन के साथ। लेकिन दिक्कत ये है कि ये होता है या नहीं, ये कह पाना या इसके पीछे लॉजिक या साइंस कि कोई प्रॉपर प्रूफ नहीं है। और ऐसे में होता ये है कि हम आमतौर पे ये सब नुस्खे करके निश्चिंत हो जाते हैं, हमें लगता है हमारी बॉडी से स्टोन चला गया। और जब फिर तकलीफ होती है, फिर डॉक्टर के पास जाते हैं, तो पता चलता है कि स्टोन बहुत बड़ा हो चुका है। तो ऐसे में जो रप्चर वो कर सकते हैं हमारे इंटरनल ऑर्गन्स को, चाहे वो किडनी हो या दूसरे ऑर्गन्स हो, वो तो है ही है, हो रही है वो भी है। लेकिन ट्रीटमेंट भी बहुत लंबा हो जाता है। अगर पहले ही हम डॉक्टर के पास पहुंच जाते हैं तो शायद इतनी कॉम्प्लिकेशंस होते ही नहीं। तो ये समझना बहुत जरूरी है कि एक यूरोलॉजिस्ट के पास जाना क्यों जरूरी है। और जैसे कि डॉक्टर ने कहा, पहले हम सबको लगता था कि अच्छा स्टोन है, बड़ा है, तो ऑपरेशन होगा, ऑपरेशन यानी चीड़ फाड़, बहुत आम भाषा में। लेकिन अब जैसा कि आपने बताया डॉक्टर अजय अग्रवाल, कि अब बहुत आसानी से स्टोन निकाला जाता है। बहुत बड़े बड़े स्टोन, 12 सेंटीमीटर के भी स्टोन सिर्फ 1 सेंटीमीटर के कट से निकाले जा सकते हैं। तो तकनीक बहुत आधुनिक हो गई है, और ऐसे में डरने की जरूरत नहीं है। बस जरूरत इस बात की है कि अगर ये सिम्टम्स है तो डॉक्टर के पास जाना है, डॉक्टर पे ट्रस्ट करना है और ट्रीटमेंट कंप्लीट करना है। एक और सवाल है जो आपसे जानना चाहती हूँ डॉक्टर, कि जब ये स्टोन निकाला जाता है बॉडी से, तो क्या खासकर उन लोगों में, क्योंकि आपने ये बताया कि कई लोगों में स्टोन फॉर्मेशन रिकरेंस होता है, बार बार बॉडी में स्टोन बनता है, तो क्या उस स्टोन को फर्दर एग्जामिनेशन के लिए भेजा जाता है कि ये क्या स्टोन है? इनिशियली जो हम बात कर रहे थे कि अलग अलग तरह के स्टोन्स होते हैं, तो ये क्या है, जिससे ये पता चल सके कि किस चीज से हो रहा होगा। कैल्शियम स्टोन्स है तो हो सकता है मतलब डॉक्टर अलग तरह की सलाह दे। तो क्या ये भी होता है?
बिल्कुल। जितना भी वॉट एवर स्टोन्स वी रिमूव, by looking at the stone we can tell whether it is calcium or uric acid, and in some cases we advise chemical analysis also, and that helps because just as I told you, stone formation is multifactorial. Number one is less intake of water because our atmosphere is very hot, like in the southern our southern states and Goa. These are very hot and humid also. So there the stone formation is very high because you are passing, because it's humid also. So you are sweating a lot. So it is, the formation is multifactorial. So number one is रिकरेंस ना हो, उसके लिए बहुत सारी चीजें जरूरी है। नंबर वन इज यू टेक लॉट ऑफ प्लेंटी ऑफ वाटर, पानी बहुत पीना है। एटलीस्ट कहा जाता है कि एटलीस्ट यू पास 3 liters ऑफ यूरिन पर डे। it it now your intake will depend upon the weather. विंटर्स में आपको हो सकता है कि 3 लीटर पानी पीना पड़े, समर्स में हो सकता है आपको 10 लीटर पानी पीना, बट द यूरिन वॉल्यूम विच यू पास शुड बी अराउंड 3 liters पर डे। तो द मोस्ट इंपॉर्टेंट इज वाटर इनटेक। सेकेंड, टू अवॉइड रिकरेंस इज डाइट, which you can check by the doctor or by the chemical analysis of the stone, which stone you are forming. But most of the time, these stones are mixed, calcium also, uric acid also. So majority of the diet restrictions you have to follow, and you have to follow lifelong, because it's a lifelong problem. It doesn't. Some people feel like you take this, you follow diet for few months only. No, because you are not going to form a stone very soon. The chances of recurrence, what is said, is 50%. Like in next 5 years, like if we are operating 100 patients now, so out of those 100 patients, 50 patients are going to form bigger stones in the next 5 years. Some may form in 1 year, some may form in 5 years, others 50% may form in 8 to 10 years. So it depends upon so many factors, your diet restrictions, how much you follow. So number one was water intake. Second is your diet restriction. Third comes medicine. There are certain medicines, but not too many medicines, which you can take regularly to avoid stone formation. If you follow all three things religiously, then the formation of stone you can avoid. But what people usually ask, डॉक्टर आज सर्जरी हो जाएगा तो अब दोबारा तो नहीं बनेगा? ऐसा नहीं है. It is not like that. Nobody can say. And there is one more confusion. Like they ask if we go for open surgery, like in the 25 years back, तो उसमें chances of recurrence are less. No, it is not like that. Whether you get it done by open surgery, whether you get it done by endoscopic surgery, the chance of recurrence will remain the same. It doesn't matter what method you are getting operated upon. So these all three things are very necessary, and you have to follow lifelong to avoid recurrence.
Right. So as you said, water intake or fluid intake, I should say, your diet and medication, etc. They form a very important role. They play a very important role in stopping kidney stone or urinary system stone recurrence. My question to you now, doctor, is that what kind of diet restriction we need to follow? Is do that depend upon the kind of stone we are having? Or many people, in general say that you should not eat eggplants, spinach, tomatoes throughout if you have history of stones. How true is that?
Like there are certain, like we tell about the calcium, or
Mm,
only we come to uric acid. So for that, the animal protein, you should keep uh, animal protein intake very less, non-veg. So if you are a recurrent stone former, you have to take very less protein. Especially nowadays, the youngsters are going to gym. They start taking a lot of this protein, extra protein.
protein supplements.
Yeah,
Yes.
if you are lucky, if you're not forming a stone, it's well and good. You take a lot of protein. But if you
Mhm.
are forming stones, you have to limit the protein, extra protein in. You have to take normal protein intake, but extra protein you have to avoid. Then tomatoes and spinach. Spinach actually is not taking too much, but tomatoes and this onions. I suggest you should
Okay.
not take too much in the salad.
Okay.
You should take, well, everything you take in moderate quantity. If you are taking
Moderate.
anything in excess, then third, I suggest these aerated drinks like these colas, whichever is having CO2. These are very high in oxalates. So you should avoid, if you are taking too much colas, the aerated drinks, the cold drinks, the sodas, you should avoid. So these are main, which if you are able to do this much only, I think it is more than sufficient.
Right. So a viewer, Ananya, is here, and her question is: are there lifestyle changes or dietary modifications that could help prevent future stones? We have already discussed the dietary modification and how important it is to keep hydrated, and medication also goes a long way in helping us. But what kind of lifestyle changes we can make, doctor? How important is a healthy lifestyle when it comes to stone formation?
Healthy lifestyles means everything now we say about like cancers also. So avoid very spicy and oily foods, drink a lot of fluids, take more leafy vegetables, and avoid being overweight. That is very important for most of the diseases. You should avoid being overweight. That is the only thing you can do, like in the lifestyle changes. Nothing else as far as kidney stones are concerned.
Okay, so even you need to check your weight. That is also important. Right. Now, doctor, one more thing, because we are talking about stones and people who have stones, they, of course, I mean, as we have spoken already, that they go to doctors, and then when they get to know that they have stone, many a times they go for quacks, they go for nuskha, they go for other, things that people are keep on saying. When after doing everything that they get to know and avoiding doctors as advice, and eventually, because after some time they'll realize that all the nuskhas, the home remedies, nothing is working, the quacks, etc., nothing is working. When they go back to the doctor, of course, I'm sure the stone have gradually increased by then, right? So, how complicated the treatment becomes. My question to you is, if a person comes to you directly after, the symptoms, and when a person comes to you after wasting a lot of time and all these things, does the treatment complications increases or varies?
Definitely. This is actually true for all the treatments in all the modalities. If you come with a 1 centimeter stone, definitely surgeries, as I told, it can be done endoscopically from the urethra, from the urinary stream, from below, without giving even 1 centimeter incision. So if you come at the right time, the surgeries are easy. If you come with a like 80 mm stone, 50 mm, 60 mm, very big stones, then definitely surgery sometimes becomes difficult. And it can be, it sometimes it is not possible to remove complete kidney stone in one sitting. It may need several punctures. We do so many big stones, then yourself surgeon becomes scary sometimes, because it's not easy. It is easier to say but difficult to do when you are doing a very big stones, because kidney is very vascular. The chances of bleeding, chances of kidney removal, like, it depends upon surgeon to surgeon and expertise also. But as the size of the kidney stone increases, the surgery definitely becomes difficult. In this, I want to add, like, we are just discussing kidney stone, but it is true for gallbladder stones. Gallbladder stones, even smaller ones, don't get removed by any medicine. In kidney, smaller stones, they may be removed by medicines. A lot of like 6 to 7 mm stone in kidney, they go by kidney by medicines in more than 90% cases. But in case of gallbladder stone, even if it is 2 mm, 4 mm, 5 mm gallbladder stone, they cannot be removed by any medicines, and the chances of complications increase in gallbladder stones when they are smaller. Secondly, the gallbladder stones, a lot of people keep harboring for years together. So we see a lot of patients coming with rupture of gallbladder, the pus formation in the gallbladder, and they keep on waiting for years. Then surgery becomes very difficult. So if you come early, definitely the chances of recovery are very fast. Nowadays, surgery is very easy, as I told. But sometimes it is very difficult because you have taken so much time in deciding, so the surgery definitely becomes, it's not that at one place it is difficult. It is difficult. If it is difficult in even bigger centers also. So my
Right.
advice is, you should consult. You should take definitely medicines, but should not uh, keep taking indefinitely. You should decide, no, it is not going. Then consult proper doctor and go for proper treatment.
Right, that is really important. And doctor, before we sum up the whole session, any take-home message for our viewers?
Take home message is like kidney stones, because our atmosphere is very hot and humid, the chances of stone formation is very high. In west, where the temperature is low, like in Europe, the chances of kidney stone formation is very less. In our country, it is very high. So we should avoid the diet which are really stone forming. We should keep hydrated well. We should keep checkup, or as I told earlier, my one advice, we all should keep on getting ultrasound at least once in a year.
Right.
Lot of diseases which we, like, lot of patients come with big stones, they say हमको तो पेन ही नहीं हुआ. Lot of patients come जिनका kidney is non functioning, they said हमें तो कभी दर्द ही नहीं हुआ. तो to avoid that, to reach that level, because ultrasound, as a common, you must be knowing, in corporate, it is a culture that at least once in a year you are getting routine checkup. So routine checkup of routine blood test plus one ultrasound whole abdomen, lot of information you can get by just an ultrasound, which is totally non-invasive, no radiation. Like in x-ray there is radiation, but ultrasound there is no radiation. And a lot of abdominal problems, kidney stones, gallstone, even a lot of cancers can be diagnosed early. So, as a habit, every family member should get at least once in a year ultrasound whole abdomen.
That was really a very informative session, Dr. Ajay Agrawal. Thank you so very much for joining us, and thank you for your valuable time and advice. Thank you once again.
Thank you very much. Thank you once again.
And viewers, thank you for your active participation. For more information and updates, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, Instagram. Thank you. Have a good day. Goodbye.